High blood pressure is rarely a singular event. It is a cumulative reflection of your autonomic nervous system being stuck in a chronic state of fight or flight. When you see your numbers spike, it is not just the heart pumping harder. It is your sympathetic nervous system flooding your bloodstream with norepinephrine and epinephrine, which causes your blood vessels to constrict and your heart rate to accelerate. Most standard medical protocols focus on blocking these signals with chemicals, but there is a profound physiological reality that most practitioners overlook. Your body possesses an internal biological brake for blood pressure that can be activated within minutes if you know how to access it. This brake is the vagus nerve, the longest cranial nerve in your body, which acts as the primary highway for the parasympathetic nervous system, your body's rest and digest control center. The first proven method to lower blood pressure in 5 minutes is based on the science of resonant frequency breathing. This is not simple deep breathing. It is a specific, calibrated pattern of respiration that resets the sensitivity of your baroreceptors. Baroreceptors are pressure-sensing neurons located in your carotid arteries and aortic arch. In an aging cardiovascular system, these sensors often become desensitized or reset to a higher pressure point, essentially telling your brain that high blood pressure is the new normal. By slowing your breathing rate to exactly 6 breaths per minute, you synchronize your respiratory rhythm with your cardiovascular rhythm, a phenomenon known as coherence. To perform this, you must inhale slowly through your nose for 5 seconds and exhale slowly through pursed lips for 5 seconds. This creates a specific pressure differential in the thoracic cavity that directly stimulates the vagus nerve. As you exhale, the vagus nerve releases acetylcholine, a neurotransmitter that acts as a direct inhibitor to the heart's electrical nodes, instantly slowing the heart rate. Simultaneously, this specific rhythm forces the baroreceptors to send a signal to the brain that pressure is too high, prompting the brain to command the blood vessels to dilate. This vasodilation is the key. Within 5 minutes of this rhythm, the resistance in your peripheral arteries drops, allowing the pressure to dissipate. This is not a trick. It is a fundamental mechanical correction of your cardiovascular system. You must understand that this method requires physical discipline. If you are shallow breathing, your baroreceptors will continue to hold the pressure high. You must focus on the exhale. The exhale is the parasympathetic part of the breath. It is where the blood pressure actually drops. If you find yourself unable to hit 6 breaths per minute, start where you are, but consciously extend the duration of your exhale until it is longer than your inhale. This simple shift in respiratory mechanics bypasses the need for pharmacological intervention in the moment, allowing your body to revert to a state of lower vascular tension by utilizing the internal circuitry you were born with. This is the first biological hack to regaining control, and it is entirely under your conscious command. The second method to rapidly lower your blood pressure is grounded in an evolutionary biological survival mechanism known as the mammalian dive reflex. While it sounds like something reserved for marine life, you have this circuitry fully functional in your own facial nerves. When the skin around your eyes, nose, and forehead is exposed to a sudden, localized temperature drop, specifically cold water, the trigeminal nerve sends an immediate, high-priority signal to the brain that you are potentially submerged in water. This triggers a total systemic shift designed to preserve oxygen and protect vital organs. The primary cardiovascular response to this signal is immediate bradycardia, or a significant slowing of the heart rate, coupled with a regulated redistribution of blood flow that reduces the overall workload on the heart. In clinical settings, this reflex is so potent that it is sometimes used to terminate episodes of supraventricular tachycardia, an abnormally fast heart rhythm, but it serves equally well as a powerful tool to force a rapid drop in systemic blood pressure. To activate this reflex, you do not need to submerge your entire body. Fill a bowl with ice water, or simply hold a cold pack or a washcloth soaked in ice water against the center of your face, covering the area around your nose and eyes while holding your breath for 15 to 30 seconds. The combination of the cold stimulus and the breath hold is vital because the breath hold signals to your body that you are no longer exchanging air, which amplifies the conservation response. Within seconds, you will feel your pulse drop. This is your parasympathetic nervous system overriding the stress-induced constriction of your vessels. By performing this for just a few cycles, you provide the vascular system with a physiological reset, effectively forcing the heart to shift out of a high-pressure, high-output state. It is a harsh but highly effective way to break a hypertensive spike when you feel the tension rising in your neck or temples. While these two methods, resonant frequency breathing and the dive reflex, are exceptionally effective for acute spikes, they are merely tools for immediate management. They do not address the long-term structural issues that caused the spike in the first place, such as arterial stiffness or insulin-driven fluid retention. However, they are essential because they give you the ability to prevent a crisis before it escalates into a medical emergency. By mastering the ability to manually override your autonomic nervous system, you stop being a victim of your own physiology. You move from a state of passive reaction to a state of active, real-time control. This is the difference between simply taking a pill and waiting for it to work and actually engaging your body's innate biological software to regulate its own internal environment. Once you have brought the pressure down using these mechanical interventions, you must transition from acute management to the underlying stabilization that ensures your baseline pressure remains low throughout the day, preventing these spikes from happening in the first place. You are not just lowering a number, you are retraining your nervous system to prefer a state of calm over a state of chronic alarm. While these two methods, resonant frequency breathing and the mammalian dive reflex, are exceptionally effective for managing acute hypertensive spikes, they are merely tools for immediate stabilization. They do not address the long-term structural issues that caused the spike in the first place, such as systemic arterial stiffness, persistent insulin resistance, or chronic electrolyte imbalances. If you find yourself needing to perform these maneuvers multiple times a day, it is a clear indicator that your baseline cardiovascular health requires a more fundamental, root cause intervention. You cannot rely on a hack to override a system that is constantly being provoked by poor metabolic inputs. The true goal of using these techniques is to give you the time and the stable environment you need to implement the actual long-term healing protocols that will change your health trajectory forever. Think of these maneuvers as the circuit breaker in your home. They prevent a fire when the voltage gets too high, but they do not fix the faulty wiring that caused the surge in the first place. The faulty wiring in the case of hypertension is almost always an endothelial dysfunction. Your blood vessels are lined with a microscopic layer of cells called the endothelium, which acts as the body's primary, smart regulator of blood pressure. When this lining is healthy, it produces nitric oxide, a molecule that signals the smooth muscles around your arteries to relax. When this lining is damaged by chronic inflammation, high blood sugar, or oxidative stress, the nitric oxide production stops, and the vessels become rigid. This is why you feel the pressure rising. To transition from acute management to permanent control, you must focus on rebuilding the health of this endothelial lining. This requires a shift in your daily intake to include foods rich in dietary nitrates, such as arugula, spinach, and beets, which provide the raw material your body needs to manufacture nitric oxide. Without this foundation, your nervous system will constantly trigger a high-pressure response because it perceives a lack of oxygenated blood flow, even when your heart is working at maximum capacity. Furthermore, you must address the mineral foundation that governs your cellular electrical environment. The heart and the vascular system function on an electrical gradient maintained by the precise balance of sodium, potassium, and magnesium. Most adults over the age of 60 are walking around in a state of chronic subclinical deficiency in these critical electrolytes. Potassium is the natural antagonist to sodium. It works to force the kidneys to excrete excess fluid and signals the vessels to widen. Magnesium, on the other hand, acts as a physiological calcium channel blocker, ensuring that the smooth muscles in your arteries do not stay perpetually contracted. If you are not replenishing these minerals through whole food sources like avocados, leafy greens, and nuts, no amount of breathing or cold water exposure will give you a lasting result. You are trying to maintain a high-performance machine with the wrong fuel. By optimizing your electrolyte status, you are essentially softening the cardiovascular system, making it more responsive to your breathing and relaxation techniques. Finally, we must confront the reality of systemic inflammation. The nervous system is heavily influenced by the chemical signals it receives from the gut and the adipose tissue. If your body is in a constant state of inflammatory alert due to processed sugars, refined grains, or gut microbiome dysbiosis, your fight-or-flight response will be permanently dialed up. This is why many people find that even when they are calm, their blood pressure remains elevated. The inflammation is acting as a chemical irritant that prevents the nervous system from fully shifting into the parasympathetic rest and digest mode. To solve this, you must adopt a lifestyle that prioritizes metabolic flexibility, the ability of your cells to efficiently burn both glucose and fat for energy. This reduces the burden on your insulin system, stabilizes your blood sugar, and drastically lowers the inflammatory pressure on your arterial walls. This brings us to the ultimate conclusion regarding your cardiovascular health. The power to regulate your blood pressure does not belong to a medication, a doctor, or a genetic predetermination. It belongs to you. You are the architect of your own internal environment. When you combine the immediate life-saving capacity of the techniques we discussed today, breathing and the dive reflex, with the long-term foundational work of metabolic and nutritional restoration, you remove the necessity for your body to ever produce a hypertensive spike in the first place. You are not just lowering a number on a cuff, you are reclaiming your autonomy over your biological functions. Use these tools when you feel the pressure mounting, but do not mistake them for the end of the journey. The journey is in the rebuilding of your vascular integrity, one meal, one night of restorative sleep, and one informed lifestyle choice at a time. This is how you protect your heart and brain for the decades ahead, moving away from a life defined by symptom management and toward a future characterized by true, vibrant, and sustainable health. If you are serious about protecting your future, you will take these protocols and make them a non-negotiable part of your daily rhythm, because your health is a reflection of your consistency. Always remember that while these methods are powerful, they are not a replacement for medical supervision, especially in a hypertensive crisis. Use your common sense, work with your primary care provider as you stabilize, and stay consistent with the biological foundations that ensure your longevity. Your body is listening to everything you do. Start giving it the signals it needs to stay strong, flexible, and completely under control.